Hello, and welcome to this week's lecture. And this week's lecture is going to be about employee compensation. We've been talking the last couple weeks about how, as an owner or a manager of an independent pharmacy, how you're going to grow the business. But the biggest way to grow the business is to figure out what are things that we can bring in to bring revenue to the business, to be a win-win with our partners. Our partners are like our healthcare providers, hospitals, physicians, our patients, and payers. And one of the things when you're strategically planning or continuing to have a business, you have to constantly, be making sure you have good employees. And we talked a couple weeks ago in our HR lecture about the importance of recruitment, um, retention, and unfortunately sometimes terminating employees. But one of the things when it comes to trying to keep employees is employee compensation. Successful companies have successful employees, and successful companies attract employees who can bring value to the business, employees who want to be motivated to provide whatever your mission is, whatever your plan is. We opened up at the beginning of this semester talking about how, as a manager, you can lead people to be successful, to carry out directives of what your vision is for your company. But one of the things to get people to want to stay is there is unfortunately sometimes is it in there for them. And obviously a successful company retains employees because the job brings satisfaction to them. It motivates them. But we need to be able to market employees and retain employees by giving them and sharing with them the attractive compensation they will get in being an employee of this business, which not necessarily always means salary. And one of the things when you are sitting down, and especially as a smaller company, such as an independent pharmacy, you may not be able to offer lucrative benefits. Sometimes, depending upon the way the market is, you may not be able to offer lucrative salaries. So, how do you in your company reward employees? Whether it is in employee reviews, incentive programs, and pay raises? And what is the value you are bringing? There are many times in my life where I've had to, you know, compete in getting people to want to come to work for me. This has happened either in the companies I've worked for or even sometimes recruiting students into graduate programs such as residencies that I had been in charge of. And a lot of times I was usually the smaller entity compared to other bigger entities, whether it's somebody looking at a lucrative hospital residency, whether it's somebody looking at they could go to a chain and make a lot more money. And sometimes what I had to offer, not, and sometimes I didn't have the, full employee compensation that they may get at other companies. I had things I could offer was, you know, a good way to learn, to grow in your career. I had also giving them a good work environment that was not hostile, that they could nurture, they could have good, collaboration with their colleagues. And a lot of times, my best selling point was I can offer a better quality of life. Whether that was in scheduling, whether that was in being able to, get certain holidays off. This is the benefits that you can have for working for a smaller company. When we look at obviously a lot of times decisions come down to what am I going to get paid? There's different ways to look at this. Wages, which when you look at a profit loss statement, which next semester we will get more back into looking at financials, wages generally refer to the hourly compensation paid to operating employees. The basis for wages is time. Many of our employees we can't not make salary. There is certain laws and regulations of who can be salary, and wages are based on that. So you also have to look at what type of employee do I need to cover the hours of operation? What is a fair market value of that position that I create? Because one of the things, especially in community pharmacy, is you want your wages to reflect your sales, and wages should only be about 11% of your sales. And so it's a constant battle and good strategic planning of what can I offer to be competitive. There are numerous websites and companies out there that, such as salaries.com, where I compare what are the wages in the industry, networking with other professionals that you might not be in direct competition to learn about what are fair wages. Salary is the income paid to any individual on the basis of time. So what is somebody's annual salary, which can be determined by their wages, or salary is I do not paying somebody on an hourly basis, but paying them on a yearly basis, quarterly basis, every 6 months basis, based on the task at hand. And also the hardest thing is the maturity curve. A lot of times where small companies get into trouble is they do not have a way to promote people to other positions, or they do not have a cap on what is the most somebody can make in this position. We want to be nice people, so every year when we do, performance reviews, people come to expect that they at least maybe get an increase in the cost of living. Sometimes the industry may not warrant that an increase in salary is needed, but the owner, the manager, still does it. And where companies can get in trouble is when their wages, exceed what their sales are. And there are times where what is the max salary that my top technician makes? What is the max salary that a staff pharmacist makes? These are things that take planning. These are things that should be developed, within your company so that you can, you know, um, determine what those should be. Because a big place where most companies get in trouble is wages get too high and they are too high compared to percentage of sales. People also, what is their worth to be paid is what is the skills that pay them, that reward them for working for you. So there are set wages of what a certified technician might make versus a non-certified technician. The company that I currently work for, we have a different delineation of technicians. We have order entry technicians and we have technician fill clerks. When somebody becomes an order entry technician, and that person could be hired from within, or that person could be recruited, for that. We do have a job description of what the duties are compared to a fill clerk to an order entry technician. When somebody becomes an order entry technician, some of the skills in their job description they need to be is proficient using the pharmacy system, the ability to bill third-party insurances, to problem solve issues with third parties, to work very well with colleagues such as your pharmacist, to be able to have good communication skills with healthcare professionals and patients. And one of the requirements we have in our company is we have an internal certification they have to meet, And if they meet that internal certification, there is a bump in salary. And our technicians and our field clerks are hourly positions, because we'll talk here shortly that you can't give everybody salary because they have to meet certain requirements of some type of managerial position to be able to do that. The other thing with our order entry technicians, we have that internal certification, but if they seek out, and we encourage within 6 months after hire in this position, they have to become nationally certified technician. And once they meet that, then there's a significant increase for that. You may have that with your pharmacist, pay rewards based on whether or not they've completed a residency, or whether or not they have gotten certifications such as board certifications, or certifications such as diabetes educator, or Pennsylvania Pharmacy Care Network provider. Obviously, the more knowledge somebody has here in the United States, most of the time those people are awarded more compensation compared to people that have less knowledge. But one of the things companies do determine, and this comes from your job descriptions, is what is the minimum requirements needed to be able to fill this job. Other factors that determine pay, all right, is obviously the job duties. And that is why in your prior exercise that you had to develop a job description. In your final project, what you have to do is write what are the job descriptions for the people to be able to carry out your strategic plan. There is a difference between exempt employees and non-exempt employees. Non-exempt employees are those who are paid hourly, and those non-exempt employees are eligible for overtime pay for hours worked in excess of 40. And an employer, by law, must have a record of time worked, whether that's just done on pen and paper, an old punch time clock, or a virtual computer punch time clock. In our companies that I work for, we have a virtual computer that is actually tied to a payroll company, so that I don't have to spend, and we kind of outsource our payroll, which is an expense, but to be able to hire somebody full time to do this, we're just not that large of a company to be able to do that. But one of the things you have to sit on is the scheduling of these types of employees. Not only do we determine what their wages are, as the example I gave you in the prior slide, we also have to make sure that, what warrants overtime, and if we are in overtime, usually there has to be additional compensation like time and a half and hours. Exempt employees are typically your managerial employees. So not every pharmacist is an exempt employee. A staff pharmacist fulfilling certain positions, duties, usually is an hourly employee. And because in a community pharmacy, the most expensive cost in your business are the wages of your pharmacist and your inventory, I encourage anybody who has pharmacists that they should be done on an hourly basis. Now, are there pharmacists that should be done on a salary basis? Those people that are exempt employees have to usually meet certain requirements, and I would encourage you to seek an HR expert just to verify these things. But typically they have to be in some type of managerial, executive, professional, or administrative positions. They must have a minimum weekly pay guideline. They're not entitled to overtime, but they must meet both the salary test and the duties test to be able to do this. Exempt employees is an attraction for some because they work a lot, or they like the flexibility of, not maybe coming in early one day and coming in late the other. Usually, obviously, salary employees are managerial positions that not always require somebody to be working, as I referred, the bench in the pharmacy that they're also doing tasks outside of the pharmacy, such as office work, strategic planning, doing employee reviews, scheduling. So, that is something you need to determine. Now, the one thing nice about exempt employees, they are fixed wages, and so they're a little bit easier to watch out and control versus non-exempt in terms of overtime. However, depending upon your states, sometimes there are rules for exempt employees on how you track hours, and even at a certain point, they may require overtime. So, other factors are employer considerations. Obviously, we are always competing for good talent, both local and national. And we're also competing for the talents of employees that have the skills and knowledge to fulfill the job descriptions that we have created. And so the biggest factors is, how strongly do we want to compete? Do we want to be the lead in the market of being the highest paid employees in the market? How do we meet the market demands of what's out there in terms of compensation, or do we want to be a lag in the market? Back in the early 2000s, when we went to the first 6-year PharmD program, this was something that was constantly happening. That we had a shortage of pharmacists, we had an expansion of the chain industry, and so constantly we had different companies, and this was even smaller companies. I was working for a long-term care company at the time, and we constantly were right at the status quo of meeting the market demands of what pharmacists were paid fairly, to maybe 6 months later lagging the market, and pharmacists coming to me thinking about, should I stay working for you or go somewhere else? And a lot of it came down to salary mainly, and also sometimes employee other compensations. Another factor to determine is, not everybody stays just because they're getting paid the most. The other thing is doing performance job evaluations. And everybody wants to feel that they're worthy of what they're doing. It stems down to when we were kids, that we want to have praise evaluation. Job evaluations, if you're Medicare B accredited, are required under federal law. In fact, when you are accredited, they're looking at, are you doing job evaluations? A lot of other accrediting bodies, such as URAC for specialty pharmacy, also looks at job evaluations. But job evaluations is a method for determining the relative value or worth of the job to an organization, so that individuals who perform that job can be compensated adequately and appropriately. And that is why you write your job descriptions. You write what is the fair wage of this job, especially if it's an entry position. What are your yearly performance evaluations? How much will you go up in the salary? Do you have different tiers that if they meet this certain tier, they just do their baseline, they haven't really grown into this position, there is at least maybe a 2% increased cost of living, or maybe there's no increase in salary. If somebody performs certain, growth in their job, then maybe you increase salary by 5%. Unfortunately, right now, because wages, and not wages, but reimbursements are very low, community pharmacy is going through a change where you're seeing sometimes either a lag in the slow of salary increases in all positions, pharmacists and technicians, to where you see some places doing salary cuts. That's why, too, I think it's important to have a classification system to attempt to group a set of jobs together into clusters. How are you going to grade them? What is your point system to be able to do that? There's numerous books out there to help you do these evaluations of what a fair evaluation is, But I think also you have to come down to looking at your profit loss statement on a year to year basis. And you still have to keep those wages within that 11%. I can't keep saying that enough, that you have to find a balance in that. Because the compensation philosophy of a successful company is that you first have good job classifications and job descriptions. You come up with an initial base compensation structure of what do pharmacists make, what do pharmacist managers make, what do merchandisers make, what do clerks make, what do technicians make. Whoever's in your company, everybody should have a starting base salary. The other thing is, what are the benefits you can offer? Some people, it's not all about money, but what additional benefits they can have. That might be time paid off, sick days, 401ks, and also flexibility in schedule. And everybody wants to be recognized and awarded. And so whether it's something such as Employee of the Month, or having a good sit down with somebody evaluating their growth and satisfaction, those all play a big role in the compensation philosophy. We do to always have to consult our state and federal regulations. And if you're a small company, I suggest that at least yearly, if not, that you consult with an outside HR company to help you with this. Because there is state and federal laws that require, at least to follow, whatever the state or federal minimum wage is. And that might be your entry level for clerks, cashiers. But are you a company that wants to be known to be paid a little bit above the minimum wage? And so, you have to adhere to those and overtime laws. And anytime in an audit or somebody wants to file a complaint to you, to, state, local, employment agencies. And that's why, too, I will also refer to the chapter on HR, which goes a lot more into the laws. You want to be able to consult those. There's lots of laws affecting employee benefits and compensations. There is the Fair Labor Standards Act. There is the Income Retirement Security Act. There is Age Discrimination and Employee Act. There's the Family Medical Leave Act. There's the Pension Protection Act. I will refer you to the chapter I'll have posted on our Blackboard site in pharmacy management in reading these laws, because you always need to consult these when you are developing an employee compensation package. Pay compression and pay inversion. What is this? Pay compression occurs when individuals with substantially different levels of experience and or performance abilities are being paid wages or salaries that are relatively equal. That is why there should be some type of delineation. I gave you the example of an order entry technician to a fill clerk. You may have, depending upon how you recognize people in the company, is there delineation between pharmacists that are doing more pharmacy enhanced services, such as they become certified to be a clinical provider, such in our state, the Pennsylvania Provider Care Network, or board certified. Because you want to be able to make sure that there is a delineation. But a lot of times companies get into problems with what's called pay inversion. It occurs when the external market changes so rapidly that new employees are actually paid more than experienced employees. This often can happen when a company does not hire new employees for years. And then when they go to have to hire a new employee and they find that they're not able to get somebody due to that they're not competitive in the salaries, they then might have to increase that. And what is your set value of doing that? Because a lot of times if you do that and bring in the market value, then to be able to retain your current older employees, you may have to bump up everybody, and that can have an significant impact on wages. And that is why in part of strategic planning should be every year is doing analysis of the market. What is out there? Are we competitive? Because there is ways to keep salaries competitive if we also make sure we're controlling other operating costs. That is why next semester, compensation packages, taking care of employees is tied so much to our everyday managerial responsibilities of operating expenses and looking for ways to maintain and increase business sales. There are also different benefits people come to expect. Some are required by law, some aren't. Obviously, in any employment, we are required as a business to pay into that employee's Social Security. There has to be some type of workers' compensation if there's an accident. So this goes back into that, there's certain types of insurances we have to buy. And then the other one is if the employee is terminated, maybe not based on performance or doing some type of, illegal act, that if they are just laid off, they are entitled to unemployment insurance. And this is a mandated protection plan that provides a basic substance payment to employees who are between jobs. And these are things when we are also planning what is the true cost of wages, we have to factor in these mandated benefits along with what somebody's hourly wage is, what are their salary or their salary wage. Non-mandated benefits such as private pension plans, all right. Obviously, smaller businesses usually can't offer some type of pension plan, but they can offer something such as a 401k. And in a 401k, 401ks, there are some tax benefits for offering this to employees. A lot of times, too, 401ks can be something that we can do offer a match. A lot of times, a fair match is offering anywhere from 3 to 4% of what the employee puts in. So this is a way that an employee can start saving. It's in a way an employee can have tax exempt salary to put away. So these are not obviously mandated. It's not required that you offer them, but if you look into these are things that can sometimes be a win-win for the owner and the managers because you are also able to contribute into these too. Other additional benefits companies may look to go into is such as child care, cafeteria style benefits, wellness programs. These are all different things that employees may be looking at to get into, but these are additional benefits that usually are offered by larger companies, but there may be ways that you as a smaller company may be able to offer these. But like I said, these are usually additional benefits. So when you're trying to share in recruitment of an employee, you should have put into writing what are the core versus non-core benefits. One of the hardest things that we do have currently here in 2019 in the United States, especially for small businesses, is the ability to buy health insurance to offer employees at a fair wage. It's a requirement under the Affordable Care Act. If you meet a certain number of employees, usually that cutoff is around 50, it's mandated that you offer insurance. If you're under that employee number cap, you do not have to offer it, but to be competitive, sometimes we want to. And so often it's very hard to get a good price, especially if you're small. Usually, when you're small, you're not able to self-insure, so then you have to buy group health insurance, and this can be a very, costly, competitive thing for companies. But if you are able to offer it, the traditional core benefits are, medical health insurance, prescription drugs, usually offering a basic life insurance on average that can be anywhere from 25 to 50,000. Vacation time paid, what is the policies of how much vacation is given when somebody is first hired, and is there a tier of how many years you're with the company that you would get additional vacation. Most pharmacists starting in the industry are at least offered 2 weeks paid vacation. Um, what holidays do they offer? Sometimes if you're a small business and you're closed, major holidays, that is still technically a benefit, even though, well, we're closed anyways, but a lot of larger companies are open on the major holidays such as Christmas, Thanksgiving. Do you offer sick pay and disability? This is where seeking at least a one-time consult with an HR company to find that. Non-core benefits can be elective, dental, vision. A lot of times too, if you do get above 50 employees in your company and you're still not enough to self-insure, there are times where you can offer these benefits. You don't necessarily have to pay these benefits. The company that I work with, that we're an 8-store family-owned chain, that we do offer dental and vision, but that's additional money that can be purchased at a lower rate than somebody could purchase if they were buying on the health exchange. So we do. Sometimes too, you can partner with companies like Affleck that they can come in, sell additional non-core benefits, especially if you're a smaller company. So generally, in terms of health benefits, as I said, it's usually medical, prescription, dental, and vision is um, often optional. One of the other things that, unfortunately, in today's the standard of practice is that you know when you are trying to purchase health insurance and you're a small company, the monthly premiums are going to be higher compared to if you were a larger company. And that's simply you're not able to partner with other companies that are similar in your industry to be able to acquire health insurance. And so if you're a small company, you have a bigger risk in terms of people using the insurance for medically necessary situations. And so a way to minimize that payment is how much does the employee have to pay into the monthly premium, and also usually today's standard, those group health insurance policies, the employees have a minimum deductible. Currently, the benefit that I have with our company is we have a family $4,000 minimum deductible. However, if you have high deductibles like that, often the health benefit you are partnering with can offer a health savings account for employees. So once again, this is a way employees can put away money on a weekly or at least monthly basis that is non-taxable and can be used when they have to pay out of pocket. And so this is also an additional benefit that employees may be looking for. Obviously, if we're a smaller company, we may not be able to offer a traditional pension plan. There are rules and formulas to determine that, but even the smallest companies may be able to offer some type of 401k plan. There are different restrictions of, sometimes employees cannot start investing right away, or they have to work for so many years for the company before they're vested that benefits there, they can take that away if they change jobs. You may have a time period of when you do match up to a certain percentage of what the employee contributes to your 401k, and there are tax benefits for this, and so that's why I encourage you to sit down with experts in planning this and also working with your CPA to see what the benefits would be for you and for your company, because even the smallest companies can do this. And for a lot of pharmacy owners who may not have the ability to have their own pension retirement plan, a 401k is a way for that owner to put away money to be able to have some savings, even if they're also hopefully going to get savings someday, when savings or revenue, when they sell their company. So most of the time when you're coming up with a compensation package, there are usually two forms. There is base salary. There is also maybe incentive pay. So there may be ways that, maybe I'm not able to raise somebody's salary or hourly wage on a yearly basis fairly, but maybe if I'm starting a new service, such as a point of care testing program or a med synchronization program, maybe there's a way that I can offer an incentive pay for that. When we do talk in our Zoom meeting, I will share with you what some pharmacies are doing for incentive pay type of compensation bonuses. So there's lots of challenges that we have in employer compensation. How do we structure good employee benefits that are competitive, and one size does not fit all for employees, nor does one size fit all for companies. We need to also, retain employees, so we have to have, to share with employees the understanding of all the benefits they're getting for working for our company, whether it's salary, health insurance benefits, 401k, time paid off, flexibility scheduling. And, this can be costly and time consuming. And obviously, this is not a profit making venture. But we cannot have a successful business if we do not have happy, satisfied employees that, or being able to, retain and hire the best employees in the industry that for our company. And we're also constantly faced with continuing rising in healthcare costs. The CEO of Toyota at one time said that I'm basically at a health insurance company that makes cars on the side. So we have to be constantly, balancing that. Once again, I'm going to go to our 11% of employee wages to sales that we have to do that. And we have limited budgets of what the payroll can look like. Obviously, too, we also have to follow government restrictions and legislation and public policies when we are working in putting together employee compensation packages. So when we look at the independent employer challenges, today's community pharmacy wages based on the industry standards should be about 11% of sales. You have to think in your company, how many employees can I afford? What services do you want to offer? And what can those employees do? This is not set in stone, but this is one of the staffing based examples that a lot of times smaller companies do. And this comes from an average of what chains and independents are doing in the industry. So, for example, if I'm filling 14 to 1700 prescriptions per week, that equates to one full-time FTE pharmacist, and you add an additional four pharmacist hours per 100 scripts per week. So this is a good way to analyze, especially if I'm above that 11% in wages, how much pharmacist time. The other thing is when we look at techs, it should be 10 hours of other pharmacy labor per 100 prescriptions. If we're looking at how many cashier clerks we have, we should look at for every hour, for every $83 of sales, that can afford 1 hour of clerk hours. Obviously, too, in today's world, and you did talk about this in your reflections on HR, strategic planning and your HR job descriptions, is that, technology and workflow is going to play a big role in how many employees we actually need to do to be able to get a job done. So, thoughts in about employee compensations. Pay attention to the pay process. How are you going to fairly offer financial rewards to your employees? And the amount paid to employees typically matters far less than the way pay decisions are made. So having written out what are your pay policies, what are your advancement policies, these need to be clear and consistent in your company, which often small businesses struggle or do not do enough strategic planning in this arena. How employees are compensated takes many forms: salaries, benefits, work conditions, challenging, stimulating work, the ability of having a non-hostile environment with coworkers, and the right mix for each person is different. So coming up with compensation, packages for pharmacists versus technicians versus clerks versus non-healthcare professional positions, those all have to be taken into consideration and at least reevaluated yearly. The employer's main goal is to structure a compensation benefit program that has the ability to attract and retain quality employees to remain competitive. And once again, being a small company, you don't always have the luxury of hiring a full HR department. But I encourage you not to do this alone. Yes, it can be costly to consult an outside HR firm, but even if it's every couple years, bringing somebody in to analyze this or to give you advice is important, because you do need to stay on top of what the employee laws are. There are companies out there that can do salary, your payroll, and also give you up to date of what the employee laws are. A lot of times too, a CPA firm that might be doing your books also can sometimes offer those benefits, because employee benefits have huge budgetary ramifications. And as I said before many times in these slides, payroll is a reflection of total sales of the company. Benefits are the hidden paycheck for employees too. So not only do they worry about what their wages are, hourly, or their salaries, or what are they getting in return. And so that is the total compensation package. Employees need to be educated of what they're getting in addition just to their salary, such as quality of life, flexibility of schedule. And also too, having something like a 401k plan encouraging, because more people contribute to that, the more that it grows, the more successful it is for everybody in the company. I thank you for your time in listening to me on this lecture. I think that this is always a very sensitive subject when you're trying to hire, retain employees. I encourage too small businesses is keeping quiet. I always have a role in my managerial is that your wages is your own personal business, but employees will talk. So you have to be careful in your confidentiality. And like I said, employees, it's not always what they get paid, it's the fairness of how they get paid. So a lot of times too in small companies, certain people are paid a lot higher than others just based on, oh, well, they've always been here long, they're more reliable. And that can get you in trouble down the road, not just legally, but internally. And the one thing that can set a company back is having to deal with day-to-day employee issues that are not related in meeting the mission of the company. Thank you very much, and please look on Blackboard the additional readings that are required for this week to help supplement this lecture. Take care.